If you have ever dealt with that nagging, persistent jaw pain, you know just how frustrating it can be. Well, today we're going to dive into a really fascinating new clinical trial that puts a pretty standard treatment up against a totally new approach to see which one, actually comes out on top.
You know exactly what I'm talking about, right? That ache right in front of your ear, the clicking or popping sound every time you chew, maybe your jaw even gets stuck sometimes. It is way more common than you think, and it has an official name.
Yep, it's called Temporomandibular Disorder, or TMD for short. And the clinical definition is pretty straightforward. It's pain in your jaw muscles or the joint itself. You can't open your mouth all the way, and you hear those little clicking sounds. But what's truly mind-blowing is just how big of a problem this is.
Get this. TMD is considered the third most prominent pain condition in the entire world. Just let that sink in for a second. It's right up there with things like chronic low back pain and headaches. We're talking about millions and millions of people dealing with this every single day.
So, that begs the question, right? If it's so common, why are we still on the hunt for better treatments? Well, the simple truth is, for a lot of people, what we're currently doing just isn't cutting it.
As the study points out, a lot of the go-to treatments have some pretty big drawbacks. Pain meds can have side effects, and you're not supposed to use them long-term. And the evidence for things like mouth guards, kind of all over the place. It's really inconclusive. A lot of other therapies just offer a little bit of relief. The bottom line is, we desperately need better options. And that is exactly what these researchers decided to do. They set up a head-to-head clinical trial, basically a showdown between two very different ways of tackling this problem, to see which one would be the clear winner.
So, let's meet our two contenders, shall we? In one corner, you've got the conventional approach, a mix of things dentists and doctors often suggest. And in the other corner, we have the experimental approach, which combines two very specific hands-on therapies.
And when you look at them side by side, the difference is pretty stark. The conventional group got what you might expect, a custom mouthguard, an anti-inflammatory drug, and some gentle mobilization of the jaw. But the experimental group, no drugs, no devices. Instead, they got two hands-on therapies: dry needling, which uses these tiny needles to go after muscle trigger points, and spinal manipulation of the upper neck.
Okay, so how did they actually test these two very different methods? Well, they used a really high-quality study design, which is super important to make sure the results are trustworthy.
Here's the breakdown. They took 120 people, all with chronic TMD, and randomly put them into one of the two groups. The treatment part was pretty intense. They got up to 8 sessions in just 4 weeks. But the real test, the thing that really matters, is what happened later. The researchers followed up 3 months down the road to see which treatment actually had lasting effects.
And after those 3 months, wow, the data told a really, really clear story. And we're not talking about a small difference here. It was a big one. One of these treatments was way more effective.
So, who won the showdown? Let's let the data do the talking.
All right, this first chart is the main event. How much did their pain go down? That tall bar on the left, that's our experimental group, the dry needling and spinal manipulation. Their pain dropped by almost 40 points on a 100-point scale. That's huge. Now, look over at the shorter bar on the right. That's the conventional group. Their pain only dropped by about 18 points. I mean, that's less than half. It's a massive, massive difference in pain relief.
But hey, it wasn't just about pain, right? It's about being able to actually use your jaw. This chart shows how much more people could open their mouths without pain. The experimental group, again, that's the tall bar, they gained an average of 12 millimeters of pain-free opening. And the conventional group, just 3 millimeters. That is a 4-fold difference, a huge improvement in just being able to function normally.
So, yeah, the conclusion here is pretty hard to argue with. The data clearly shows that the combo of dry needling and upper neck manipulation led to way bigger improvements in both of the things that matter most: less pain and better movement.
And to really nail down how big of a deal this is, the researchers calculated a number, 1.8. It's something called the number needed to treat. And what it means is this: for basically every 2 people you treat with the new experimental therapy instead of the old one, you get 1 extra person who has a major, clinically important improvement in their pain. In the world of clinical research, a number that low is just incredibly powerful.
So, what's the big takeaway from all this? What does this actually mean for someone out there struggling with jaw pain? Let's kind of break down why this new combination seems to work so well.
The study suggests it all comes down to connections in the body.
See, there's a really strong link between the nerves in your upper neck and the nerves that control your jaw. So by treating the neck, you can actually have a direct effect on the jaw muscles. At the same time, the dry needling goes right to the source of the problem in the jaw muscles themselves, helping to zap the pain and improve blood flow. It's like a powerful 1-2 punch.
Now, of course, good science is always honest about its limits. The authors are quick to point out that they didn't have a placebo group. But their goal wasn't to test against a sugar pill, it was to see if this new combination could beat a common, real-world treatment package, to see if it was a better option for people and their therapists right now.
And in the end, the study's own conclusion just says it all loud and clear. They found that the patients who got the dry needling and neck work had significantly greater improvements in both pain and jaw opening than the group that got mouthguards and medication.
So, this leaves us with a really exciting question. For the millions of people who just haven't found relief with the usual methods, maybe this study is pointing the way forward. Maybe looking beyond the jaw itself to the neck and using these kinds of targeted therapies is a powerful new direction for finally getting a handle on this incredibly stubborn and painful condition.